Good evening, and thank you for joining this special episode of Healthy Heart Nation's rapid fire update on the impact of COVID in medicine, business, and health. Do not adjust your dial. We will not be joined by Dr. Batiste or Dr. Walsh today, but we will be sponsored, and this session is brought to you by Healthy Heart Nation. I am Danette Batiste, the CEO and Executive Director of Healthy Heart Nation, and we are a 501c3 nonprofit organization that is formed with the mission to utilize African American professionals to educate communities of color to narrow the disparity in the African American community that persists in education, business, justice, and health. The Healthy Heart Nation team brings a wealth of experience with individuals that have made an impact in the community of color through publications, lectures, workshops, and community events. Healthy Heart Nation has brought these experts in various disciplines together to make a concerted, multi-pronged impact to narrow and eliminate that disparity gap. Tonight, we bring you a digestible, rapid-fire webinar to address COVID concerns from the pillars of education, business, and health. We are joined by our special guests, Dr. Nana Afu-Manan, Dr. Sorrell Williams, and Chanel Hawkins to this compelling conversation. Dr. Nana Afu-Manan serves as an emergency physician, public health practitioner, entrepreneur, and humanitarian. She is well experienced and well trained in her field of work, utilizing her skills and expertise to solve global health crises. Dr. Afu-Manan founded the Shared Harvest Foundation, a nonprofit that provides student loan repayments with volunteer projects and rewards credits toward student debt. Within this network, Dr. Afu-Manan created the My COVID-MD initiative to provide equal access to coronavirus testing and much needed social services for the communities that face the highest rate of mortality due to COVID-19. With this, I'll welcome Dr. Afu-Manan, and we'll ask the rest of our panelists to wait backstage. We'll be with you shortly.
Hi, how are you, Danette?
I'm great. It's so nice to have you here, and it's great to have you open our session tonight.
It is an honor and a pleasure.
Great. So we'll go ahead and get started. And so our first question to you is COVID-19 still a risk to Americans?
Yes, yes, and yes. And I can't underscore that more, because if Americans have remembered, together we have collectively ran through 5 waves of the pandemic. Yeah. And every time we thought we were right over it, there was another hit, and it devastated a lot of communities who were increasingly more vulnerable. And usually it's around the winter time that we saw those soars. And so we are definitely we're seeing a downward trend. It's good. It's really great. The Delta variant, which took route since June of 2021, seems to be dying down, but we still have a lot of our population who's still unvaccinated and therefore high risk. And there's a lot of people who are not getting the flu vaccine. And so we're talking about other opportunity infections at this time.
Okay. And I know this wasn't on the list of those questions, but are most people afraid to have both the COVID vaccine and the flu virus? Are there any risks to having them both?
That's a great question. And there is no risk to having them, because we are not dealing with manipulating live viruses together. So you can absolutely take the flu vaccine and the COVID vaccine, any 3 of them, just fine.
Fantastic. Okay. So is the vaccination and or booster needed when I have, or someone has already had the COVID-19 virus?
Again, yes, and yes. And let me explain why. We are all different human beings. We don't know what our immune system is doing until you look under the, as we say, under the hood. And that really means for those who have been infected before, we are seeing in the studies, they still have a 5-fold increased risk of getting COVID again. And
Okay.
when they do end up in the hospital. What
Mhm.
we are seeing is those who are vaccinated, even if they get COVID, they are not ending up in the hospital or in the ICU in critical care. And that's
Okay.
real facts. The other
Mm,
thing about it is that you assume you think you're immune, but the immune system is not an all or none sum game. It's
right.
about continuity and it's about what
Mhm.
your environment is impacting. So you may have certain amount of immunity, but we don't know if
Mhm.
you have a maximum amount. And the
Okay.
only way to find out if you're really building antibodies is to pay for the expensive test, not the quick antigen test and an
Mm.
antibody test. It's the
Mhm.
blood draw under a severe microscope, counting your antibodies. And realistically, that's not going to happen for the majority of the population. So you want to
Okay.
get vaccinated to protect yourself and your ecosystem.
Fantastic. Thank you so much for making that so plain. So when people are vaccinated and they get COVID, what you're saying is that the COVID virus and the vaccinated people aren't hospitalized as a result of having COVID. I mean, is there some issues with any kind of pre-existing conditions that, because you find people who have been vaccinated to, hospitalized.
Mhm.
So is it primarily due to their, their pre-existing conditions, or what's the situation with that?
Well, that's a great question and example of our dear Colin Powell, right? So the
Mhm.
big example was he was vaccinated and he hit a hospital and he died. What's
Yeah.
going on?
Right.
Reality is the COVID vaccine, number one, is not a cure. It decreases your risk of getting COVID, number one. And
Okay.
if you do, it decreases your body's impact to the virus itself.
Okay.
For people who are already immune compromised and are
Mhm.
dealing with cancer, melanoma, these are where our immune systems and antibodies are growing from. If you are already dealing with an underlying medical condition, but this is under attack, it's very difficult. And who's to say the vaccine probably increased the amount of time that he was alive. So
Right.
the truth is, it did provide some protection, but we were
Okay.
dealing with a lot of people who unfortunately have so many other things going on in their body and an immune system that is challenged that it may succumb to COVID at some point in time. And it's
Right.
even more important for us to vaccinate those who are healthy and have strong immune system because we want to protect them. Those of us
Yes.
in our community who do not have that, who are vulnerable and don't have the opportunity to protect themselves.
Right. Definitely. So, what is your message to those in the community that are vaccine hesitant?
Well, I always just stay away from the word hesitant because
Okay.
as a Black woman, I
Mhm.
always got questions.
Right.
So
Right.
I
Right.
support being doubtful. I support
Okay.
being critical. So if
Mhm.
you are vaccine critical or if you are vaccine doubtful, the thing
Okay.
you want to do is get your questions answered. And you are so right to have questions, but
Mhm.
make sure your questions and the answers that you receive are sound answers that are
Yes.
based on science. And if
Okay.
you are holding on to the I'm not going to get vaccinated for because of myths or something else, someone on the neighbor on the corner store told you, you're doing yourself a disservice because you are smarter than that to dissect the real question of why you're not doing it and get
Right.
that question answered.
Yeah, and there's a lot of distrust, right, in the African
Right.
American community with the medical establishment. So, a lot of us bring that into our decision making, and it is challenging to trust the system. So, the underlying question for you is the vaccine safe?
The vaccine is safe, and it's safe because not just because when it came out, but since it's come out, there has
Mhm.
been so much sound research and data collected from
Okay.
people who've had the vaccine, from people who've had COVID, for the original research design of the vaccine itself, beyond even just the science behind it itself. So it's understandable if we were in 2020 in November and you're suspect of the data. We're
Right.
talking about November 2021, a year's worth of millions of data points that we
Mhm.
can now look at. It's a
Right.
whole different ballgame. And when we think about the number of people who have died versus the number of people who have been saved, and the fact that we're almost out of the woods, you
Yeah.
have to accept the fact that there is some truth to this vaccine. It is working. The other thing I will make a point to say that as a medical
Mhm.
person, I get it. You know, you should distrust the medical system because we have
Mhm.
done wrong in our community.
Mhm.
We
Mhm.
have we have even the way right now boosters
Right.
question. You know,
Right.
I thought
Right.
J&J was one and done, and now you're telling me get the second one. You
Right.
know, so all of that is hard. It's hard for
Mhm.
the average person to reconcile when you're already doubtful. And
Yes.
that's why I say the most important thing is to link up with someone you trust in the medical field, not
Right.
someone who, you know, goes to the pharmacy and gets all these paces and has a kitchen, you know, and coming up with the cocktails. I'm talking about people who you trust that have science background. And
Right.
our community is filled with them. That's what's so wonderful
That's
right
true.
now. We have
Right.
a blessed pipeline of
Mhm.
medical doctors, nurses, and if you don't know anyone, this is a great opportunity here on this platform to ask the question. You can contact
Absolutely.
Shared Harvest. We will answer questions day and night. But the most important thing is know where to go and to get the right information.
And I like the fact that you said like there's not a problem with the question, right? It's
Not
that's you're supposed to try to seek to understand, to ask your questions. But when you're given information, of course, you have to trust one thing or the other, right? You either trust to not trust it or you trust to trust it, right? So you have to do your research. You have to really just look at the data, if I'm hearing you correctly, like not just what it should do. We have actual data that shows what it has done. And
Mhm.
those should be the things to help, help you make a decision or be comfortable with that decision.
Yeah. And I will just add that, you know, we're all human. So if you encounter somebody in the medical community that just kind of blew you off or
Hmm.
made you feel uncomfortable about your question, on
Right,
to the next. Don't use that as the sole example of how people should talk to you or engage you. Just
right.
accept that this is a human that does not get my question. I'm on to the next person who can hopefully help me. And I guarantee you, there are other people out there that will address you with respect and understand your questions are valid and look for the answer for you.
Absolutely. I feel way more comfortable talking to you. I'll just tell you that. But we appreciate your time today. And so, if you don't mind waiting for us backstage, we'll go ahead and bring in Dr. Sorrell Williams.
Thank you. It's been a pleasure. I'll
Thank
see you
you.
backstage.
Okay. Dr. Sorrell Williams is the U.S. Inclusion and Diversity Lead at Sloan and a business ambassador for Healthy Heart Nation. He has a PhD in organizational psychology. Dr. Williams has gained a wealth of experience partnering with private, government, and nonprofit organizations across industries to drive transformation. Now, he primarily focuses internally at Sloan, where he partners with stakeholders across the US to embed diversity and inclusion into how they attract, hire, promote, engage, and retain employees. Additionally, he works with community organizations to impact the lives of those in our neighborhood. Welcome, Dr. Williams.
Thank you, Danette.
Question to you. What is the impact of proof of vaccinations on businesses?
In short, a lot, and it depends. And my answer will illustrate what I mean by that.
Okay.
And where I'd like to start is to think about the motivation for businesses and why businesses might be doing it, or at least the stated motivation for many businesses. So if you listen to or take a look at what businesses have stated about
Okay.
why they
Mhm.
want to vaccinate people, it's often about the health and safety of their employees. That's
Okay.
often the stated motivation.
Mhm.
And if you think about why that might be the case, and conversations I've had with business leaders about this,
Mhm.
is it's so more often than not, these businesses do have healthy and living employees to actually achieve the mission of the business. So
Okay.
if you think about what Dr. Afo-Manin just said about the probability of getting seriously ill or dying as a
Right.
result of taking the COVID vaccine, then it would be in the business's best interest to make sure that its employees are safe and healthy. So
Okay.
if you just think about something as extreme as the United States military, as an example,
Okay.
it's in their best interest to make sure that people aren't sick or dying, so they have
Mhm.
people available to defend this country. If you think about airlines as an example, same thing. If they
Mhm.
have a bunch of people that are sick and or dying as a result of a pandemic, then it will be much more difficult for them to conduct business, to make money. They might have to cancel flights. They won't
Right.
be able to make as much money. So the same thing happens for most businesses. This is often why businesses are driving towards this for
Mhm.
business operations and continuity. That
Okay.
said, the impact of that, again, it depends on where you're looking at that. So for a lot of businesses, they've really been successful in encouraging many people to get the vaccine as a result of what people are calling mandates. So there's been a
Okay.
lot of compliance with 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 people actually getting vaccinated when they do have these mandates in effect. Now, of course, there have been some people who haven't done this and who've decided
Mhm.
that they will not get vaccinated for whatever reason, and just
Right.
they might leave the organization. So that's
Mhm.
another impact. But what we've been seeing is that impact is minimal. Most people by far have been getting vaccinated in organizations. Some organizations have had 100% vaccination rates. So
Mhm.
I was actually surprised when I saw a few months ago that there was in southern Mississippi
Mhm.
a company that had 100% vaccination rate.
Wow.
And this was surprising to me in part because of, I'll be very transparent about
It-
my own bias as to what's happening with the South with respect to
Mhm.
vaccine hesitancy. Sorry, Dr. Afo-Manin, but you know what I mean, right? Vaccine, people questioning vaccines.
Right.
But this organization was a casino. And again, if you think about it, it's
Yeah.
in the casino's best financial interest to make sure that they don't shut down as a result of an outbreak. So I
Right.
get it. So that's been part of what's happening is that people have been complying. Another
Okay.
thing to consider has been what's happening to, depending upon what type of work people are doing and where they're working. If you take a look at people who are frontline workers and
Okay.
people who are who are in companies where not just that they need to be vaccinated, but people need to be vaccinated to attend to come into the business. And
Okay.
what's been happening here in many places across the country, it's been difficult for them because they've had challenges having to be the vaccine police and tell people either show me your vaccine or make sure
Right.
that people are being vaccinated, and
Okay.
sometimes causes confrontation as a result. So that's
Mhm.
been some other unintended consequences of
Okay.
what's been happening. But mostly, a lot of people have been getting vaccinated as a result of these mandates. And then many people, the people who haven't, it has been very minimal impact from a business perspective of the people who have it. And as a result, I would argue that we've minimized and decreased the likelihood that businesses would have disruptions to operations
Mhm.
and continuity because of absenteeism, because people
Right.
were ill or people just aren't there because they're sick.
Okay. So you said a lot, which is is great.
A
Yeah,
lot.
you said a lot. And so we kind of, so essentially you're going back to the fact of the business of business is business, right?
Mhm.
And business gets done by people, right? And so the people have to be healthy and present in order to deliver what is necessary for the business. So their motivation is coming from a place
Coming
of
from a place of
profitability, all of the things that are necessary to make them a viable business, whether that be commercial, government, or otherwise. Is that pretty much a good summation of what you've said?
100%.
Okay, fantastic. And I definitely agree with all of the things and the examples that you've given. So the second question is, what is the impact of Cal OSHA standard masking requirements for unvaccinated employees. So where they're requiring employers to provide and ensure that the use of face coverings whenever required by the CDC.
Yeah, very, very similar.
Okay.
That there's compliance within businesses with these types of things, especially certain types of private industries. It's a lot easier for them to, I hate to use the word police, but I can't think of a different word at this point, but to essentially do the work to make sure that people are complying with those, with that regulation or that mandate.
Right.
And they, again, depending upon the type of business or where you are within any given geographic location, it may be more or less difficult to have people comply with those.
Okay.
I think we've all seen in the news that there's certain locations within the country, because of what I would argue are political reasons, are much less likely to comply with mask mandates, vaccine mandates, or suggestions, etc. So again, it kind of depends upon where you are within the country on the efficacy of that. But I would state that, again, a couple of consequences. One is people complying, and then if you think about the research that's been shown with respect to masking and how that does reduce the transmission of the COVID virus, is that what that also has done is, again, decrease the likelihood. It's not going to be 100%, but decrease the likelihood of transmission and spread and illness and death of their employees.
Right. So, for instance, like even with like in terms of requirements, where you go to a place of business or whatever, and they say no shirt, no shoes, no service, right? Like that is the requirement to go in, and they have, as a business, they have the right to mandate those things.
Absolutely, 100%. It's a very similar thing. And again, the reason why that you'll see that is often because of public health. The same reason why you're not supposed to take dogs unless it's a service animal into certain locations where food is being served. It's a public health issue. It's not people trying to control what you do or any grand conspiracy. We don't want or need people to get sick. Sick people cost. It's expensive, especially in this country. It's really expensive to be sick.
Right. Absolutely. So what is the impact of workforce COVID testing?
This one, similar to when you think about the impact of understanding where exactly there might be an outbreak and trying to minimize the risk and spread of that. Then there's also the downstream impacts of the individuals who might be potentially resistant to that. Fortunately, the way we've set things up from a testing perspective, that we wanted to make sure that it's as easily accessible and a low cost to the employees. So the United States government has essentially made it such that COVID testing is free, that you don't have to pay for COVID testing. So there's no financial impact, there's no cost to the business, there's no cost to the employee. And what that does, if we have compliance with that, again, is help us identify where there might be challenges, where we might be able to mitigate that risk, and again, continue these business operations. But as I stated before, with respect to the relative disparate understanding, beliefs, desire to comply with, whether it's vaccines, whether it's masks or testing, then sometimes people can become resistant to that and just not want to do it for whatever reason. But again, I think for the most part within businesses, those folks have been minimal. We'd likely have seen more conversation and more hyperbolic reactions to these things that are really exist. But broadly, people have been complying with these. And then the people who decide, and often where instead of getting the vaccine, you have to get tested, a lot of people are more comfortable with that. So I would say that's been the impact of that.
All right. So I know that you have that psychology background. And so, if you were to go, like, what would you do differently in terms of the messaging and or, the positioning of the need for vaccinations if you had the opportunity to do so?
I probably start with I probably frame it in such a way that it's in our best interest as a company, as a people, to get vaccinated.
Right,
I say, hey, are you interested in your company being successful?
right.
Are you interested in that? What
Mhm.
does this company need to do to be successful?
Okay.
As an example, if it's a consulting company, you need to have consultants where I work for that
Hmm.
are available
Hmm.
and to be able to send out to your clients to do that work and
Right,
let them know if people are sick and are dying as a result of this pandemic, it minimizes our ability to do that. And
right,
as a company, when we're more successful as a company, that trickles down to you, whether it's with bonuses and growth and so on and so forth. So it's in our collective best interest to do this.
right.
And it is part of it is the messaging. But another
Hmm.
thing that I would do too is more listening,
Okay.
because to your point, from a psychological standpoint,
Hmm.
different people have different reasons for why they may or may not be hesitant to getting the vaccine. Some of it might be due to misinformation, which I recognize is a huge problem. Some of it could be due to real concerns that people might have, whether it's
Hmm.
with respect to some pre-existing condition that they're
Right.
concerned that a vaccine might exacerbate, as an example. So
Okay.
I get that. So it's
Right.
important to understand where people are coming from and listening,
Hmm.
and also being empathetic to why people are are behaving in ways that they are, and
Right.
trying to listen and provide comfort to that and assure them that
Mhm.
everything is okay.
Right. Well, thank you very much, Dr. Sorrell. That was really exceptional. We're going to send you backstage and we're going to go from a Sorrell to a Chanel. How about that? Chanel Hawkins is a graduate of UCLA and obtained a Bachelor of Science degree in psychobiology. Mrs. Hawkins has served as a classroom teacher, a school psychologist, and administrator in various districts across Southern California. She values a holistic approach to better understand students' academic and behavioral needs. In her current capacity as a program specialist, Mrs. Hawkins provides school staff with guidance and support in developing individualized education plans for students with special needs. Welcome, Chanel.
Thank you so much for having me today.
Absolutely. So we'll get right into your questions.
Okay.
And one of the first questions that we have for you is, what was the impact of COVID on the educational system in 2020?
I mean, to say that this impact was vast is speaking minimally of it. I'm going to take you back to March 2020, where we did get the guidance from the state about
Mhm.
having our students and staff not going to school sites or any district building capacity.
Right.
Um, this took on a huge toll because we needed to continue to meet our student needs
Mhm.
until the end of the school year,
Right.
but in a different format.
Right.
So many school districts had to develop a plan, and pretty swiftly,
Mm.
because we needed to still make sure that we were being accountable for the
Mhm.
children's education.
Right.
So we had to come through with a plan, and it involved, ensuring that all students had technology, because students
Okay.
then learn from a distance
Mm.
with some type of device, whether it was an iPad, Chromebook, you name it, whatever the district had access to. That's what
Right.
they had to utilize.
Okay.
Now, as the year progressed, districts did realize they need to hear what their communities' preferences are when it comes to their
Mhm.
child's education. While considering the impact of COVID, we saw what it did to our communities. Our communities were shut down,
Right.
and therefore we had to follow procedures in school districts that shut down. But
Yes.
nevertheless, we wanted to provide, and I say we because I'm speaking just of all districts in California,
Right.
we wanted to provide formats where our families felt comfortable having their children participate in. So this looked like students participating in distance learning, but in an in-person model. So should there have been any changes in terms of the COVID epidemic kind of getting better, they could come back to
Right.
school. That was one.
Yes.
But also districts provided a virtual format for the entire year so that students could
Mhm.
learn virtually with the
Right.
classroom teacher. And then we
Mhm.
had some families that pursued a home-based model where in fact our parents were the child's teachers and we would consult with the parents on
Okay.
curriculum and instruction.
Okay.
Now, aside from just the instruction piece, then we have to talk about the impact it had with our actual district in terms of our employees. So
Mhm.
districts had to make sure they were in close contact with the health department because we
Okay.
wanted to make sure we were practicing any of the guidance that certainly was being, at least considered to be
Okay.
appropriate and safe,
Mhm.
because all districts
Mhm.
want safety for their kids, so, and our
Right.
employees. So we had
Right.
to really collaborate with health department. We had to also consider the needs of our employees who
Mhm.
at one point didn't need to share some confidential information about their health conditions,
Okay.
but were vulnerable to share that. So
Right.
keep in mind, we had to even restructure where our employees would work. Some of our
Mm.
employees had to work in a virtual format for the entirety because their bodies were immunocompromised. And we
Okay.
have to take that in consideration. We also needed to look at the special needs population. This is a population that I service
Mm.
consistently and daily. So
Mhm.
looking at some of our populations have very medically fragile students,
Okay.
students with intellectual disabilities. So there were exemptions that we had to also keep in mind that their physicians were providing in terms of not wearing a mask.
Mhm.
But aside from the business of the
Mhm.
district, let's talk about the social emotional impact this had, not only on our
Absolutely.
kids,
Don't forget the parents.
exactly, the families.
Right.
The families, we're talking financial stressors where some of our
Mhm.
families were not able to work because
Right.
they had to stay at home with their children. They didn't have the
Mhm.
financial means maybe to pay for daycare. So some of our parents had to really change their lifestyle to support their child's education.
Wow.
So we saw a huge increase with our Family Resource Center being that first line of action of support for
Mhm.
our families because of the stressors they were experiencing.
Right.
Then we talk about our kids who were used to coming to school, interacting with their peers daily, both in a
Right.
structured and unstructured format. Let's keep
Right.
in mind we're human. So in
Right.
structured formats, we will, take in instruction and sit like
Mhm.
a scholar, if you will. But then we have
Mhm.
recess time, lunch time, PE
Right.
time, where kids can be kids and be themselves. Keep
Right.
in mind that was removed once we went to this distance learning format. Kids were only seeing each other in the actual classroom that was virtual, which was
Right.
only for a certain time frame, and then
Right.
it was gone. So
Right. Which
how were
is
they interacting? How were they staying socially engaged?
right. Right.
Fun.
No. I mean, and it wasn't that long ago, right? So, like hearing you talk through the history of all of that, like I remember that day in March, right? And
Right.
they were like, okay, we're going to send the kids home for a little period of time. And of course, us being unaware of everything, I'm like, oh, it's going to be a couple weeks.
Mm-hmm.
Okay, it's been a month.
Mm-hmm.
Okay, it's been like a longer than that. And then we went into the summer, but I'm sure by the time school starts again, you guys will be able to go back. So, it sounds like it's so far away, but we're so adaptable
Mm-hmm.
and so it's almost like when you've had a remodel of your home and you forget what it used to look like, right?
Right.
Because you're now used to seeing it in its newest format. So, with regard to education, I don't know if there's been any kind of studies on in terms of the learning, right? So you take those cognitive tests, or the kids
Mm-hmm.
take a test in the beginning of the year,
Mm-hmm.
and then the beginning of the year and the end of the year. Have there, and I don't know if this is something that you can even speak to, but was there a decline in terms of what the kids represented that following year based on having gone through the COVID situation?
Yeah, to some extent, yeah, and that depended on how supportive, families could be in the
Right.
capacity that what they were thrown into. So
Okay.
absolutely, we did see an overall decline,
Mhm.
but not just from an academic standpoint. Even again,
Emotional.
from a
Yeah.
social emotional standpoint.
Mhm.
We have kids who
Mhm.
have never been to school before. Think about our preschool population, those youngsters.
Right.
Some
Right.
of them, it's their first time ever this year in school.
Wow.
We're having to go back to some of those developmental skills that should have been, at least kids should have been exposed to by now, but just simply holding a pencil now.
Right. Right.
Yeah. Yeah. It's had its challenges, and
Right.
I'd be remiss not to mention the fact, and just going back on that social emotional piece for particularly
Mhm.
our adolescents.
Mhm.
We did see an increase in suicidal ideation
Yeah.
because they weren't connecting with their peers as they
Isolation.
typically would.
Right. Right.
So, from a wellness standpoint, we needed to provide supports not only for our students, but
Right.
also our staff, because our staff, although we're adults, we're humans, and we're
Yes.
going to have some obvious reactions. Some are going to
Mhm.
be different from our peers, depending on how we handle these stressors. So,
Right.
we needed to ensure that we had supports available to our staff from a wellness perspective to make sure that we keep them engaged, keep them realizing that they do have support systems outside of
Mhm.
just those at their school campus. We have support
Yes.
systems throughout the district. And
Yeah.
one more aspect I do
Sure.
want to mention too,
Okay.
from a maintenance and operations perspective, because remember, our goal is to make sure our schools are safe, all of our buildings and districts are safe. So
Right.
keep in mind, we had to look at some of our ventilation practices,
Mhm.
our
Mhm.
custodial support. They were having to do a bit more things outside of their demands of a usual day to day. And
Right.
they're having to, implement, prevention procedures, cleaning and sanitization. It's having its impact globally. I want
Right.
people to know it's not just at the school sites in the classrooms. It's having a vast effect on the district in and of itself.
So it's a lot of retraining and reconditioning, right? In terms of what the new norm looks like and what
Mhm.
it's going to be evolving into as time goes by.
Absolutely. And it's constantly changing based on
Ex-
mandates that are coming
Right.
out.
And that leads me to my next question, which is what is the impact of mandates like those California requiring vaccination of students and teachers? We've seen, a lot of protests and things on that side of the house as well.
Right. So let me start by saying,
Mhm.
even though the state, provides guidance and
Mhm.
mandates,
Mhm.
districts are going to operate differently, and
Mhm.
they're going to go by based on what their county is saying, what their
Okay.
community is saying. So I'm going
Right.
to say that not all districts are operating in the same fashion when it comes
Okay.
to the mandates with students and teachers getting vaccinated.
Okay.
So, I mean, there is one very large district here in Southern California where it is
Mhm.
now required for students and staff to be vaccinated.
Okay.
But there's districts that are understanding of concerns that
Mhm.
their employees have. So there's districts where vaccination is not required for students or staff.
Okay.
However, we do implement consistently across the state the mask requirement. If
Okay.
you're indoors, whether you're with people who are vaccinated or who are
Mhm.
not vaccinated, you
Mhm.
have to wear a mask. And it's,
Right.
of course, around kids as well.
Okay.
Keep in mind, now we're having some of our employees, and well, all districts are having to ask about the vaccination verifications. So
Mm.
you've had to, as an employee, provide documentation, whether you're vaccinated or not.
As
Now,
well as testing, right?
well, that's my next point. So if
Okay.
you're not vaccinated, so an
Mhm.
unvaccinated employee, what
Mhm.
is beautiful about school districts, they are supporting this free of service. But
Okay.
those that are unvaccinated have to engage in weekly screenings.
Okay.
And
Okay.
it's not the invasive, nasal. It's less invasive, but you do have to get tested every week because our goal is to make sure everyone's safe.
Okay, so that required like that weekly testing is only for the unvaccinated, or that also will depend on the district?
No, it's typically just for the unvaccinated.
Okay.
If you've shown
Okay.
your vaccination verification,
Mhm.
that's sufficient enough.
Okay. Okay.
Even those who, let's say, if there's, sometimes in schools, people are exposed and
Mhm.
therefore we have to do quarantine measures. But if you
Yes.
have been vaccinated and you are asymptomatic, you can
Mhm.
come to school. Even though you might have been exposed, more than that 15-minute period with 6 feet or
Right.
less distancing. If you're
Right.
vaccinated and you're asymptomatic, you can still come to work. But
Yeah.
those that are unvaccinated, they do need to quarantine, meaning be in isolation for 10 days at least, even if they don't have symptoms. But if they do have symptoms, definitely have to quarantine.
Which is extremely disruptive, right? So especially to the
Absolutely.
students, the parents, and everyone involved. And how do you maintain, the continuity in the classroom when you have this happening? And, as a parent, with a student in public school and private school, you experience that. Like, you get the notification, someone's been exposed, someone's been identified as having COVID. Your child could have potentially been exposed to them. And, when that first happened, we were keeping the kids at home,
Right.
and until we can get a test. And at that time, it was taking a couple of days.
Yeah.
But every week you're getting those same notifications, because of course the kids are exposed to these students. I mean, it's hard to say that they're not. So,
Right.
how is the school adjusting to, having to have, maybe you have 10 kids in class one day, the next day you're only left with 5. Like, how are they dealing with that?
Well, it can be quite disruptive to the child's education, as long also with the instructors. They're too having to, quarantine themselves at times. So we're talking classrooms that might not have an instructor. And even though we have a substitute system, it's unfortunate to say it's been inconsistent.
Right.
Because of how people are feeling about COVID. We're not getting as many subs as we consistently had in the past. So we're talking a huge disruption to the child's educational process.
Okay.
Not only them being absent, but also maybe their instructor being absent for some time. So it's going to have an impact, and unfortunately a negative impact to the child's education.
Okay. So what is your message to students and parents grappling with the decision to vaccinate or not to vaccinate?
We're about safety. We're about ensuring that we're communicating the same message that our health department is communicating to us. So we are delivering the same message. We are asking parents to even consult with their physicians, their child's pediatrician, to see if that's something that they want to pursue. So our message is consistent, but ultimately it's left up to the family in terms of how they would like to pursue this pandemic. I mean, it's really just left up to how the families view the vaccination. So we're communicating the same message as our health communities, our county health department. We're delivering the same message. We're making sure that they're well informed about the vaccinations, the types of vaccinations, just to ensure safety for all.
Okay. Thank you so much. Appreciate you. So for now, I'm going to invite all our guests back for our joint discussion, and we'll go ahead and bring them back to the screen now. All right, guys. So, I know a little bit about all 3 of you all. And if I were to take a guess, I would assume that you all may have questions of each other that maybe I didn't cover. So maybe we can start there. I don't know if you guys have any questions for your other panelists.
I was just excited to hear fellow Bruin out there.
The connections, we never know until we're here, right?
Exactly.
No, I've learned a lot, and just piggybacking on both what school and business are doing. I used to say, because I'm an ER doctor, the EMS fighters are on the outside. They have to pack and go and just bring them. And so, when we're like, how did you bring them? And what happened? We're in our wonderful, comfortable hospital. We have no idea what's going on. I feel like in this pandemic, it's the same at the school level. Like, you are dealing with so many families, kids, administration, safety. There's so many elements. And then we get to the hospital and we're like, don't even understand the number of fires they have to put out just to keep that ecosystem safe. The same for companies. They're large adult ecosystems
Right,
we have to deal with and manage all these compliance and keep business running, keep school running. It's been tough.
Actually,
well, go ahead.
Say I do have a question. This is related to something Dr. Afulmanen said earlier when we talked that made me think a bit about how science works. We started having the conversation about the debate about booster shots, right? And do we get a booster shot? Do we not get a booster shot? As a scientist, I understand how science works, and science is not always definitive. And people will say things like, well, they said this at one point, now they're saying this. Again, as a scientist, I understand that as you gather new
evolution,
you start to change your understanding of what the situation is, what you should do. But I do not think most people understand that and do not have that scientific literacy. So what I would ask you is, from like a public health standpoint, how do we fix that?
Yeah, that's a bigger problem of the pipeline, you know, and we were talking about, we have created this in the health and medical community where just not enough Black and brown doctors exist out there, and they're not in the community. So science and conversations around science and scientific research and how to understand papers is just not part of our normal lexicon in family, you know, and so that you can't expect that overnight, and it's such a complex issue. All of a sudden, people are just going to get what herd immunity means, and all these other pieces. So it really starts with what we were talking about, is gathering those small groups that do exist and elevating them, amplifying them, having platforms like this, and constantly sending the right messages over and reiterating it over and over and over again. But for us, we have a personal responsibility to stay on top of the science too, because we don't want to go out there and disseminate information that's old news, right? I mean, you know, as a scientist, the minute it is printed, is old, right? And there's another one coming up next week, and so it's work to keep up with this, but we just need to be honest. And when we say things, we don't say this is the holy grail. This is what we know now. You know, this may change in a month, but this is the best decision for you based on what we know now. And at this moment.
So it's almost like the COVID script is written in pencil, not pen at this point in time, because we're trying to get it all figured out. And it's not about like, okay, we don't want to be wrong, but we want to be right, and we want to be more right as time goes on. And that may require that we make some changes and adjustments to what has originally been put out there, you know? So it's something that is stagnant and fluid, and ever changing, right? But the purpose is that the changes are to make us better than we were the day before. And you can't do that if it stays the same.
Exactly. And to that point, there is two big depots of data. A lot of questions around side effects and adverse side effects. VAERS is a very common one, but many people of color do not report their side effects. So people do have a hard time accepting what's coming out, because they say, oh, my cousin had this, and my niece had this experience. But we want that data set to be as diverse and inclusive as possible. And the only way that happens is if people report it through these national data sets.
Yeah. And also some of the things that both of you guys kind of mentioned is just the fact that our culture is more, you know, we're steeped in verbal, right? Like, you know, back in the stories were passed on in the communities. And it wasn't just that those stories were passed on in the communities, but the stories came from people in the communities who trusted the storyteller, right? So, you know, it's really important that we build those relationships. And those relationships won't come in a forum with thousands of people on them, right? It's going to come from something where, you know, there's a relationship built on trust and consistency. And so, Chanel, in terms of like the education system, you know, how would you speak to those relationships and how what you're saying to these parents and teachers really depend on your relationship with them in the first place?
It really does. And we have to also consider the cultural influence as well. We have various cultures that have different beliefs.
Right.
And I think the consistency of our message is going to help those who are maybe on the fence or vacillating between whether or not to go ahead and get vaccinated. But you
Right.
can't ignore, family beliefs,
Mhm.
cultural beliefs, spiritual beliefs.
Right.
Those are what you're going to have to keep in mind,
Mhm.
and in a sense, respect the position that
Right.
people are taking at this time.
Right.
I think the more we get information from,
Mhm.
our physicians and
Mhm.
scientists, I think the more comfortable we will feel. Right now, I'm going to be honest, the big topic is now kids can get vaccinated. A lot of our families are wondering who were on the case studies, which kids were tested.
Right.
Very
Mhm. Reasonable.
legitimate
Right.
questions that
Mhm.
we still don't know. So maybe if
Mhm.
we could speak to that a little bit, because that's who I'm working with, these 5 and above, age 5 and above now, because now it looks like the vaccine is going to be approved for our
Right.
younger populations. At first it was the 12-year-olds and above, but now
Mhm.
it's going down to
Mhm.
5-year-olds. So
Mm.
I think we need to hear a bit more information and what research was used in order to come to this conclusion so quickly.
Do either of you guys have anything you can add to that? Because I know I don't have anything.
Well, one of the things I wanted to drop in the chat was actual resource for that, to look into that. And thank you to Chanel for bringing that up, because it is true. These were all studies, with pediatric case studies, it's all opt-in, right? So
Mm.
parents have opted in to have their kids be part of this study. And
Okay.
so we do have a good, and I would say not the strongest denominator, and that's the bottom of the total power. It gives you the power of the test. It could be much larger. And it's still early. So I would say the same thing. I have not dived in deep. It just hit yesterday, or so I said today, when the FDA approved. There are 2 very important critical studies, and we call systematic reviews. So systematic reviews, quick lesson, is the difference between doing 1 study and doing 5 studies under 1 study, right? It
Okay.
gives the power of the findings greater when you put more under 1. It's like the same thing of, you carrying a rope or a rubber band. You put 3 rubber bands together, it's harder to break, right? But 1 rubber band, they snap. So that's the same thing as how they approach systematic studies, is they bring more smaller studies together, take out all the things that they aren't in alignment with, put all the things they are in alignment with, and then come up with, is there statistical significance? And so based on those systematic studies, they were able to say that there is a positive statistical significance that the vaccines work for age groups 5 to 11. Now, the next step you want to do, now you know the study has power, then you want to look at, where were these kids coming from, right?
Okay.
Does it reflect your population? Does it reflect kids with immune compromise? That's when you start dissecting it. And that's where it all depends on you and your individual. And that's why your relationship with your doctor, your pediatrician, is going to be critical in the early parts of these suggested recommendations. I will lastly mention that we have 2 big camps of information that are coming out from a federal government. We have our FDA, and you have your CDC. FDA does not give recommendations for how to disseminate things. They just decide whether it is safe to use or not safe to use.
Okay.
So FDA, based on their studies, have said it is safe to use in this age group. Now we have to wait for the CDC to weigh in what conditions is it the safest, and what are the recommendations to the Department of Public Health at the local level. So just so to give you a context, of there's always all these different players that have to chime in, but definitely we have to wait for CDC recommendations.
Okay, so it sounds like you were saying essentially that it's a sample size, but that sample size is based on volunteers.
Yes.
And we know we don't volunteer. And when I say we, you know who I'm talking about.
Well, again, I don't want to generalize, because some of us do. Some of us
do. You're right.
Some of us are into scientific research. Not enough of us do. And so it's still important to look at what that denominator was and where the population was coming from. it had to be significant
Absolutely.
enough for the FDA to co-sign on it. I will say that. But
Okay.
again, as a personal physician who's very skeptic about everything,
Mhm.
I want to still see the numbers myself.
All right. So we've got 5 minutes left. And what I would like to do is just do a round robin. And, we will start with you, Chanel, in terms of like, what would you like to leave our audience with tonight?
Safety is key.
Okay.
Keeping our all of our members of our community, whether they're children or adults,
Mhm.
we want to make sure that they're safe.
Okay.
And we will continue to follow regulations, guidance that is sent to us so that we practice the exact measures that are being communicated to make sure that all students are safe in our school districts in California.
Fantastic. Thank you. And Dr. Afolamonin?
Sorry, I put my mute on there. I agree and echo that, but I want to say we're at the eve of Halloween, and I just want to reiterate there is no boogeyman here. The vaccine is safe, okay? But the most important thing is talk to folks. Don't hide in your corner with your thoughts.
Right.
Talk about them, feel confident about how you're feeling, and get those questions answered. But there is no boogeyman here. It
Right.
is safe vaccination.
Absolutely. And that's very helpful. I just want to add, talk to people who know, right? Because we just think, okay. Okay. And Dr. Williams?
It's semi-ironic that Dr. Afolamonin said talk to people, because mine was going to be listen to people. Seriously, because we often aren't listening to seek understanding, but are listening to respond, and have our own what I call psychological noise that we filter through information with. So if your mother tells you one thing, if your spouse tells you the same thing, if your child tells you the same thing, if the government tells you the exact same thing, you will likely not hear the exact same thing.
Don't forget your hairdresser, though.
And your hairdresser.
Okay.
You're likely not to perceive and receive information the same. So listen, when you do talk to people, listen to understand. And when you're trying to have conversations, if they're with people who might be a little resistant or hesitant or curious, whatever words you choose to get the vaccine, listen to why. Don't make assumptions as to why. Don't try to push. Listen more than you speak.
Absolutely. And I think that's very helpful. Well, for us, from the Healthy Heart Nation standpoint, our goal is to, really make an impact in our community in a positive way. And essentially, we really want to make sure that the messaging is not only accurate, but it is coming from people that look like the population that we're trying to reach. It's very important. And so overall, we're trying to build trust. We're trying to build, a track record in the community that shows where we're going. And like you said, we're not trying to tell people what to do. We're trying to give you the information that we all have from these various areas that you can listen to, that we can listen to you, and that you can go back and maybe research some of the things that were stated or said. So with that, we want to thank all of our guests for joining us today. Our panel has been exceptional. We thank you all so very much for joining this discussion, and we look forward to furthering it. If you all have questions or you need anything else from us, please visit myhhn.org, which is our website, and feel free to like and subscribe to our YouTube channel, which is Healthy Heart Nation. Thank you so much for letting us spend this time with you tonight, and have a great one.